So hi, this is Dr. Larsen at SLC Med Spa. Today we're going to do another Learn at Lunch. I know we have a lot of clients that like these, and hopefully we can start doing these more often. Today what I wanted to talk about is hormones again. I know we've talked about this before, but I continue to get questions about hormones, and almost daily I hear from my clients that their practitioner has told them that they shouldn't be on hormones, and that they don't help you, that they're bad for you. And some of my clients actually get yelled at by their practitioner if they are on hormones. That's how much they are against the idea of using hormones. And so I just wanted to talk about this again today. I think women's health and how women are treated and how we're taking care of their hormonal issues is one of the biggest issues in medicine. We're using hormones and synthetic hormones that cause disease, and the women should not be treated with these hormones. There are natural hormones that they can be treated with that actually prevent disease. So I wanted to just talk about this. Here in our clinic we use what are just called bioidentical hormones. I don't like to label them as bioidentical hormones. A lot of the traditional medicine, traditional physicians, they don't believe in bioidentical hormones. I don't like that word. I just like to call it estradiol. Estradiol is the hormone that women make. I don't know why we call it bioidentical hormone. You can get estradiol in Vivel patches and through pharmacies and through prescriptions. We just used estradiol. We also use just testosterone. I don't know why we call it bioidentical hormone. It's just testosterone, just like what your body makes. And we can also use progesterone, just exactly what your body makes. It's called, in a prescription form, it's called prometrium. So we can get in prescriptions the exact hormones your body makes, calling estradiol, testosterone, and progesterone. The non-traditional doctors are calling these bioidentical hormones. I don't like to call them that. I call it estradiol, testosterone, and progesterone. It's common sense that if you are low in estradiol, it's causing you symptoms, it's causing you health problems. We would replace that hormone with estradiol. It makes absolutely no sense at all to use a synthetic hormone that is not estradiol. Estradiol is available, so if you're low in estradiol, it's causing you hot flashes, it's causing you health problems. Why don't you just replace it with estradiol and not a synthetic estrogen or an estrogen from a horse? It makes absolutely no sense. So we're calling these hormones bioidentical hormones. They're just estradiol, testosterone, and progesterone. That's what this is. Those of us who are treating in kind of a non-traditional way, some of the attitudes towards this hormone replacement is that it's not validated by literature, that there's nothing to show that you should be doing this, that it isn't the correct way. And there's actually there's a lot of doctors that will get very emotional, upset at their patients when they're being treated with hormones, and they're saying that it's absolutely not the right way to do it. Well, because of this, and because I keep hearing this, I finally have gone through all of the literature and all of the education that I've done over the past 7 years, which is hundreds of hours of education on hormones. And I put all of the literature, all the articles together into one paper, and we sent that out in an email this past week, and hopefully you'll see that email and you can look at all of the literature that supports dramatically the use of using estradiol, testosterone, and progesterone to help and improve your health and make it so you feel great. So who am I? Why would I be an expert in this? Many of us that do hormones this way are actually considered quacks. Well, I'm not a quack. I actually there's only 5% of all medical students are elected into the Alpha Omega Alpha Honor Society. I was elected into that honor society in medical school. Only the top 5% of all students in the country are elected into that honor society. I was one of them. I went to the very top residency program in the country. It was at Oregon Health Sciences University. What we did in our residency set the standard for the rest of the country, which meant the rest of the world. We were the first residency program to introduce ultrasound into the emergency department. I was one of the very first emergency physicians to be trained on ultrasound, and now all emergency physicians across the country know how to use ultrasound. That was developed in my residency program. The president of American College of Emergency Physicians was the director of my program, Dr. Moorhead. The president of American Board of Emergency Medicine, Hal Thomas, was also the chairman of my residency program. The top physicians I trained with in the world were in my residency. Dr. Trunke, who was commander-in-chief in Desert Storm, he was my trauma surgeon that I worked with daily. What we did at Oregon Health Sciences not only set the standard for the rest of the country, but all the standards, all the protocols that are done in the Army and in our armed forces were set by the residency program that I went to, Oregon Health Sciences University. So I'm far from a quack. I've read many, many articles, and some of them, when we're trying to decide about hypothermic protocols, amiodarone, lidocaine, some of these protocols that we came up with in the emergency room, yeah, those were hard decisions. We were looking at statistics, very close, hard to decide what to do. Women's health, these are simple articles. There's no controversy in this. There should be no controversy in this. There is a correct way to do hormones, and there is a wrong way to do hormones. So yes, I have qualifications to go through these articles and look to try and figure out what is going to be the best treatment for women. I've done it my whole entire career. And looking at women's health issues and hormone issues, should be no controversy. It is black and white. There's a wrong answer and there's a right answer. I'm going to talk to you a little bit about basic physiology, basic physiology, basic anatomy. Hormones are made in different glands in your body. When the hormones are released into your blood, they don't go to the liver. They go into a big blood vessel called inferior vena cava. All the blood from the inferior vena cava goes to the heart. From the heart, it then goes out to the rest of the body. That's how hormones are supposed to circulate in your body. Eventually, most hormones the hormones will get back to the liver, which is the place where they get metabolized. So that is the correct physiology, circulation of hormones. When you eat something, everything goes into your stomach, and then from your stomach, all the blood from your intestines and your stomach goes into your liver. It first goes to your liver. So if you were to take a hormone, any kind of hormone, and put it in a pill and ingest it, it goes into your stomach. Where's it going to go first? It's going to go to the liver. That's where it gets metabolized. That makes absolutely no sense. That is very simple, the wrong answer. It's not the correct way to do it. It is just common sense. Anybody would know that. If you told someone, well, all the hormones get metabolized in the liver, why would you put it in your mouth, swallow it into your stomach, and have all the hormones blast the liver, which injures the liver, and then it increases C-reactive protein in your body, which increases inflammation. When that happens, you have increased blood clots, heart attacks, and strokes. Basic physiology can tell you the wrong answer is to take a hormone orally. Your ovaries, your testicles put the hormone into the blood, goes back to the heart, all throughout the body. It's not supposed to go through the liver. That is the wrong answer. It's not supposed to go that way. So basic physiology of hormones are not supposed to go through the liver. 2, basic hormones is that when we're using natural estradiol, testosterone, progesterone, the studies have shown that they decrease disease. The synthetic hormones, especially Provera, are not identical to our hormones, and they cause disease. They cause breast cancer. They have increased chance of heart disease, increased chance of clots. So synthetic hormones are not the same as our natural hormones. So our traditional way of treating hormone deficits in women are not replicating the natural way of circulating hormones through our body, and we're not using natural hormones. So those are the big problems with hormone replacement. We're not giving it the right way, and we're using the wrong stuff. So going through all of these articles and reviewing all these articles, please go to my Facebook post, go to see my email, and you can see the literature yourself. And if your physicians have questions about this, please take these articles, take this paper to them, and they can see all these articles that support the use of hormones for women and for men. So in my article, that I wrote, I just went and talked about the benefits of hormone replacement. The big benefit, especially for women, is heart disease. So heart disease is the #1 killer of women. 200,000 women will die of heart disease every year. That's 5 times more than breast cancer. So about 40,000 women will die of breast cancer. 200,000 women will die of heart disease. It's the killer. It kills more women than all causes of cancer combined: breast cancer, colon cancer, brain cancer, skin cancer, ovarian cancer, uterine cancer, all cancers combined. The #1 killer of women is heart disease. The very best thing you can do to prevent the #1 killer of women is to do hormone replacement. In the article I wrote down multiple articles that support this, that show that these hormones decrease your chance of heart disease by 40 to 50%. How good is that? Well, when you consider a medication that most physicians really think you should be on, they think it's very, very important for you to be on, which is cholesterol medications. Most studies show that cholesterol medications decrease your chance of a heart attack by 2%. And also, ever since we've started using cholesterol medications, the number of heart attacks hasn't decreased at all. So a medication that your physician thinks is very, very important for you to take to get a 2% decreased chance in heart attack, can you imagine how important it is to take something that's going to decrease your chance of the #1 killer of women by 40 to 50%? It is very, very important, especially when you consider that that's the #1 killer, 200,000 women a year, and 40,000 of breast cancer. Most women aren't going to be on hormones because they're really afraid about breast cancer, which we'll talk about in a minute. But what you are most likely going to die from is heart disease. Okay, then I listed a few articles about Alzheimer's. Alzheimer's is increasing. It's going to cost this country billions, if not trillions of dollars. It is so costly on our society to take care of people with Alzheimer's. And the cost is just a small part of the problem. It's a huge problem on families. It's a huge problem on the patient. It's just a devastating disease, and it keeps increasing. What is the very, very best thing you can do to dramatically decrease your chance of this awful, awful disease? The very, very best thing you can do is hormones. Absolutely 100%. Multiple studies have shown that it decreases the chances of Alzheimer's, and it just happens to be that the very best study, 1,800 patients, big study, was done right here in Utah in Cache County. It showed that there was a 30% decreased chance of Alzheimer's if you were taking hormones. We're all concerned about our cholesterol. For that 2% improvement, can you imagine 30% improvement in Alzheimer's, your chance of getting Alzheimer's by using hormones? That's a really big deal. So heart disease, dramatic decrease in your chance of heart disease, dramatic decreased chance in Alzheimer's. Osteoporosis. Osteoporosis is becoming a bigger problem as people get older. There's going to be more hip fractures, shoulder fractures. It's becoming a bigger problem. The biphosphonates, the medications we use, don't really decrease the chance of fractures. It just makes your bones hard, but they still remain brittle. The very best thing you can do to improve your bone density is, again, hormones. Especially when you combine testosterone and estrogen. Estrogen stops the release of calcium out of your bone. It doesn't build bone. Testosterone is the thing that builds bone. So when we're replacing hormones, we use testosterone and estrogen, especially when we use pellets. Pellets can increase your bone density 8.3% a year. There is no medication that can even come close to that kind of improvement. So osteoporosis, big, huge problem with hip fractures, suffering from patients. you can get more improvement on your bone density with hormones than any other medication you can take. Living long. Okay, so there's been multiple studies for both men and women that show that you just live longer when you're using hormones. When testosterone is, the 4 really good studies for men and testosterone is when testosterone is below 600, those men die younger of all causes. So I have multiple men who come in all the time and say, oh, well, my physician said my testosterone is normal. It's within the normal range, it's 300. They're 30 years old with a testosterone of 300. This person is going to die young of some cause. 4 very good studies showing that low hormones makes it so you die younger. We all want to live longer. These hormones not only make you feel great, but you're going to live longer. A very good study in women also showing that when their hormones are low, that their life expectancy is less. And then let's get into the issues, the big issues of why some physicians don't want to treat with hormones is because of cancer. For men, it's prostate cancer. So yes, if a man has prostate cancer, testosterone can make the cancer grow faster. That is true. So when men have prostate cancer, we can't treat with testosterone. We try and get rid of all of their testosterone. But literally every single study that has been done has never ever shown that it actually causes prostate cancer. I've listed in this article the different articles. There is not one study that shows that testosterone causes prostate cancer. In fact, there's a few studies out that show when men have low testosterone and they get prostate cancer, they get the aggressive kind of prostate cancer, the kind that goes to your bones and the kind that kills you. Men with higher testosterone, when they get prostate cancer, it's one that can be treated and it's cured. So testosterone does not cause prostate cancer. Absolutely not one study shows it. All right, then the other big question is breast cancer. So the Women Health Initiative study that came out years ago showed there was a dramatic increase in breast cancer, and so everyone came off the hormones. Well, if you look at that study and you look at the Prempro, Provera, and Premarin, yeah, huge increase in breast cancer. It does cause breast cancer. In fact, if you've been on Prempro and you get breast cancer, all of the court cases are settled out of court because the maker of Prempro knows it causes breast cancer. But if you look at the arm of the study where they're just using Premarin, there was no statistical increase risk of breast cancer when using the awful, terrible horse urine Premarin. In that study, that arm of the study, no statistical increase risk of breast cancer. In my paper, I wrote down multiple articles that show there's no increased risk of breast cancer. And if you go in 2001 in the Obstetrics and Gynecology, they did a review article of breast cancer research from 1975 to the year 2000. They went over 45 studies. Out of those 45 studies, 82% of the studies showed no increase in breast cancer. 13% did show an increase in breast cancer. 2% showed a decreased risk of breast cancer. So if we're using estradiol, we're giving it the correct way, there is very little, if any, increased risk of breast cancer. If you're giving hormones the wrong way and you're giving synthetic hormones, absolutely there is an increased risk of breast cancer. So when you consider that there's going to be 200,000 women who are going to die of heart disease, and there's a therapy that can decrease your chance of heart disease by 40 to 50%, and when we consider that 40,000 women are going to die of breast cancer, and we may have a 1% increase in breast cancer with hormone replacement, obviously as a physician, I have to recommend hormones. Even if one person dies of breast cancer, there's going to be many people of my patients, many of my patients who are not going to die of heart disease. They're not going to suffer from Alzheimer's. They're not going to suffer from broken bones. They're going to feel better. They're going to have better muscle mass. They're going to have a happier life. So looking at the literature, and if I practice evidence-based medicine, which I was taught at the #1 residency program in the United States by the top physicians in the world, If I practice evidence-based medicine and I look at the evidence, I have to recommend giving hormones. If I don't, I'm a quack. Sorry, that's probably something I should have said. Erase that, Russ. No, but if I look at the evidence, I have to recommend this. It's going to save many of my patients' lives. So anyways, when we're doing hormones, there is a right way to do it. There is definitely a wrong way to do it. There's a way that causes heart attacks, strokes, breast cancer, blood clots, and make you feel awful. There is a way that decreases the chance of heart attacks, strokes, Alzheimer's, bone density problems, and make you feel amazing. It's very, very simple. It's not rocket science. We replicate the body's own production of its own hormones. We use the exact hormones that your body makes, and we try to do it in a way that replicates what your body used to do when your ovaries worked. So if we were going to try and replicate exactly what your ovaries used to do, what would you do? Would you put something in your mouth? No, wrong answer. Through your skin with the lotion? Maybe. That's actually a good option. When we put the lotion on your skin, the hormone goes through your skin, into your blood, back to your heart, all throughout your body, and eventually a little bit gets back to the liver. That's replicating the ovary pretty close. What's even better is the use of pellets. So when we implant a pellet under your skin, in your hip, it's like we're implanting an ovary. These pellets actually get their own blood supply. Little capillaries dig into the pellets, and the hormone, which is exactly like the hormone that your ovaries release, gets released right into the blood, just as if your ovary was releasing the hormone, goes into the inferior vena cava, goes back to your heart, goes all throughout your body, and it doesn't go to your liver. So when we're using pellets, we're replicating what your body used to do most closely. That's just common sense. Common sense, I don't even need a study to tell me the right answer with this. Common sense would be use the exact hormones that your ovary makes and replace it in a way that most mimics what your ovary used to do. And is this a big complex process? Absolutely not. I mean, check this out. That is the estradiol. That is estradiol right there in the palm of my hand. It is literally, I mean, on the tip of my finger. That is it. That's estradiol. We implant that under the skin. It's like it's magic. It's like a magic pill. We implant that under the skin. It goes into your bloodstream. It protects your heart. It protects your brain. It protects your bone. That little sliver of medicine lasts 4 months. I mean, it really seems just impossible, but it does. That little sliver of medicine just protects all of those organs. 82% of the studies show it does not increase the chance of breast cancer and dramatically decreases your chance of the #1 killer of women, heart disease. I mean, could you imagine this little piece of medicine? I mean, it just does not hurt. To put this under your skin, it's painless. So it takes me about 2 to 3 minutes, maybe 5 minutes at the most. We make a little teeny nick in the skin. We push this under your skin and we put a little steri strip over it. Most women don't even feel it at all. I do the procedure and they said, "Have you actually done it?" And I'm like, "I'm done." They do not feel it at all. And then it just doesn't hurt and they feel great. I've gone over today the literature that supports the use of this, that it's going to improve your health. As a physician, as working at evidence-based medicine, I have to recommend this. I have no choice. If I'm not following evidence-based medicine. But to be honest with you, most of my patients care less how it's helping their health, what it's doing to their heart, how it's preventing Alzheimer's. Most of my patients don't even know it's even doing that. They don't really care. What they do care about is they feel completely 100% different. They are happy. They no longer have joint pain. They have energy. They have zest for life. They are now sleeping for the first time in years. They have a relationship with their spouse. they feel amazing, and they will not go without it because they feel so much better. That's the main reason the majority of my patients come here and do this, because they feel so much better. The reason why I'm passionate about it, and you can see my emotion in my face, is because I feel bad that there are still women on Prempro. It's still $1 billion drug. That women are still getting oral hormones. That women are not getting hormones. That's what I'm passionate about. I think it's the biggest tragedy in our healthcare system is how we take care of women and women's health issues. When you look at the statistics and how we're treating women, and that there are still drugs actually on the market that actually cause cancer in women, it's awful. So I'm passionate about it. I love to see my patients feel good. I love to see them happy. I love to see their relationships saved. I love to see them come off of their antidepressants, which almost all of them do once they're on hormones. I love to see their hot flashes go away. I love to see them finally sleeping. But I tell you, my passion, my emotion comes from knowing all of the lives that we're saving with these hormones. It's awesome. All right. Well,
can you talk a little bit about men? We got a question. How do pellets differ in effectiveness to testosterone injections?
Yeah, sure. So with men, so the procedure is painless, but you are sore for about a week after you get the pellets. So that's a little bit different. Women, there's just no pain at all. But the neat thing about men is the pellets last 5 to 6 months. So with pellets, you come in, yeah, you're sore for 4, 5, 6, 7 days, and you're done for half a year. You come in twice a year, and you just have this nice, steady release of hormone. With the shots, a lot of men, when they're doing shots, their blood gets a little bit thick. I'm not sure exactly why that happens, but with shots, some men, to get their level up to where you need to be, and having the doses high enough with shots, sometimes the blood gets a little bit thick, and that doesn't tend to happen with pellets. Pellets is just a nice, steady release of the bioidentical testosterone day and night. The level is very consistent and works really well for men. So a little bit sore for a few days, but levels are steady all the time, and the studies have shown that you don't get the thick blood as you do with shots. And talking about men, the cream, so the gels and the cream are only going to increase your testosterone by about 200 points. So if your testosterone level is down around 200-300, well, we're trying to get you up to 600. That's the point where you live longer, where the all causes of death decrease. So we want to get you up at least to 600 because I want to make you live longer. And with creams and gels, that's only going to get your testosterone level up maybe 100 or 200 points. So if your level's down around 200, I'm only going to get you up to 400. I'm not going to get you up to that magic number of 600. So creams and gels aren't going to work for you. So it has to be shots or pellets. Pellets is the best. It's the most healthy. Your blood just doesn't get as thick. Any other questions?
No, that was kind of it.
Okay, well, thanks again for tuning in at this Learn and Lunch. Again, hormones save your life. They make you feel amazing. There is a right way to do it. There is a wrong way to do it. Our lab is open Tuesdays and Thursday mornings and Wednesday afternoons. Our lab takes any insurance, and the thing I love about our lab is if your insurance denies it, you don't get hit with this huge, massive bill. When my patients go over to St. Mark's or LabCorp or other places like that, and their insurance denies it, they get stuck with a $1,500 bill. That does not happen with our lab. They're really good at getting things covered. You don't need an appointment. You can just walk right in on Tuesday morning, Thursday morning, Wednesday afternoon, get your labs checked. We don't just start hormones randomly without checking your labs. I mean, if your hormones aren't off, we don't treat with hormones. So we have to check your labs, and then we get you started on the hormones, and then we do follow-up labs after to make sure we're giving you the correct dose. That's the way hormones are supposed to be. That's how we're supposed to do hormones. So you can get in on those days, get your labs checked, and we can get you going, get you feeling good, and really keep you healthy. Thanks for tuning in at Learn at Lunch, and I hope I see you soon.